This is Radio Health Journal. I'm Nancy Benson. This week, teaching kids how to take medicine safely.
Over 58,000 emergency room visits last year were caused by adolescents self-administering medications.
Over-the-counter drug safety and kids when Radio Health Journal returns.
Colorectal cancer is the second leading cancer killer in the United States. It can be prevented with screening, which is a big reason that colon cancer deaths are down over the past 15 years. Here are the facts. Colon cancer strikes men and women equally, and most people who develop it don't have a family history. The biggest risk factor? Your age, according to Dr. Doug Fagel, president of the American Society for Gastrointestinal Endoscopy.
Everybody should be screened for colorectal cancer starting at age 50 or earlier for people with certain risk factors. Colonoscopy is the most effective screening test and the only one that can actually prevent colon cancer. Some people worry about preparing for colonoscopy, but afterwards, people often tell us they're glad they had the test or wish they'd done it sooner. So our message is simply this: prep, scope, live.
Find out more about getting screened and why it's important at screenforcoloncancer.org. That's screen, the number 4, coloncancer.org.
Picture this scenario. A young adolescent girl has a cold and her period at the same time. In other words, she's miserable. She wants relief fast and has her parents' permission to access over-the-counter medications in the medicine cabinet. So she takes the recommended dose of a cold remedy to treat her sore throat, congested runny nose, and cough. Then she takes a different over-the-counter medication specifically for menstrual cramps and bloating. She figures no problem since each medicine targets different symptoms and she's taking the recommended dose. She should be safe, right? Wrong. If our tween continues dosing both medications as directed for the next 24 hours, she could be at serious risk for irreversible liver damage.
There are too many ER visits in this age group. Over 58,000 emergency room visits last year were caused by adolescents self-administering medications. And this is over a third of all emergency room visits from medication overdoses that are from those over-the-counter medications. So it's important to teach your tweens that just because they're over-the-counter and you can buy it at the grocery store doesn't necessarily mean that it's always safe and you can take it whenever you want. So the most common errors that I see are that parents leave medications out and a tween might think, oh, I have a headache, it says take 2, but my headache's really bad, I'm going to take more. Or they mix medications with the same ingredient.
That's Dr. Tanya Altman, Assistant Clinical Professor of Pediatrics at Mattel Children's Hospital at UCLA and spokesperson for the American Academy of Pediatrics.
By age 16, approximately 90% of adolescents report self-administering over-the-counter medications, which is a huge number. And we know that the majority of these adolescents begin to self-administer over-the-counter medications between age 11 and 12. So these are the tween years. And tweens really want to start taking charge of their own health and be part of the process. And I see this every day in my office. But they are still tweens. So one of the things I talk to parents about is that it's really important for parents to talk to their tweens. And this is a great opportunity for learning. Parents need to provide guidance on taking over-the-counter medications, how to properly do it, just to make sure to avoid any accidental overdoses or trips to the emergency room that can be potentially dangerous.
Altman has partnered with a number of organizations in an effort to get the word out about over-the-counter drug safety.
Research shows that what tweens learn at this age, they carry with them for the rest of their life, and this is especially true with health. So if you're talking to your kids about eating healthy, about taking over-the-counter medications, they're going to remember that. So when it comes to taking medications, you want to teach them to always read and follow the directions on every label, on every bottle. Never take more than the maximum amount that's written there. Learn what active ingredients are, and never use more than one medication with the same active ingredient.
Acetaminophen is a good example. Experts say acetaminophen is the most common drug ingredient in the United States and is found in over 600 different over-the-counter and prescription medicines. The FDA recommends taking no more than 4,000 milligrams of acetaminophen in a 24-hour period.
I think a lot of consumers don't treat over-the-counter medicines with the same respect that they treat prescription medicines. And what I mean by that is they think if one's good, 2 might be better. They don't realize that these are medications that are just as potent as prescription medicines. Many times the over-the-counter medicines come over-the-counter in full prescription strength, so they have the same side effects, the same adverse effects, and they need to be taken as directed.
That's Dr. Janet Engel, Executive Associate Dean, Professor, and Head of the Department of Pharmacy Practice at the University of Illinois at Chicago College of Pharmacy.
Acetaminophen is a very safe drug when taken as directed. I think it's really important for consumers to follow the directions and follow the dosing information. If you stay below the 4 grams per day, it is very unlikely you're going to have any problems with your liver. In terms of how much more that you have to take, it depends on the patient. It depends on how long you've done it. We've seen liver failure when somebody takes a lot of acetaminophen all at once. And we've also seen it where somebody takes more than they should be over several days. So it's a little bit hard to predict the exact amount that will cause problems. But what we do know is less than 4 grams is safe.
Let's go back to our tween who's having a miserable day. The cold medication she's taken contains 325 milligrams of acetaminophen, as well as an antihistamine. The menstrual medication she's taken also contains acetaminophen, 500 milligrams of it, as well as an antihistamine. If our tween continues taking both medications for 24 hours, she'll have gone over the danger line by 1,300 milligrams. By then, her liver may already be permanently damaged. Only then, when nothing can be done, does the patient experience nausea and vomiting. But sometimes those symptoms may be mistaken for a worsening cold or the flu and prompt taking even more medication.
He called me stating he had flu-like symptoms. He felt really bad, stomach hurted. He just couldn't shake this feeling, confused, sweaty.
That's Sharon Melke. Back in December of 2010, her 23-year-old son Matthew wasn't feeling well. He'd been taking an over-the-counter cold medication containing acetaminophen for more than a week. He'd also been taking it too often. When Matthew didn't return his mother's phone calls, his uncle went to his apartment and found Matthew unconscious on the bathroom floor.
He was comatized at that point. We went to the hospital. He got transferred to Northwestern Memorial on the transplant floor waiting for a transplant. And it took 40 hours. They found a match, and then he had a transplant. He did really good. We got him for an extra year with us, and then the liver failed because it wasn't compatible. It rejected.
Matthew died at age 24.
Any medication can be potentially dangerous if too much is taken or if too many doses are taken too close together. These guidelines apply to all medications across the board. Medications are metabolized and eliminated through your body in different ways, so different medications can be toxic in a variety of different ways. But no matter what the medication is, if a teenager takes too much of it or takes it inappropriately, it can lead to serious consequences.
I would like to see more education done where we really work with consumers to understand that they have to read the label of their over-the-counter medications. They need to follow the directions. If they have questions, they need to work with their pharmacist. I would like to see patients educated more not to use multiple medications with the same ingredient. And that includes checking the active ingredients not only of their over-the-counter medicines, but also their prescription medicines. And that's where the pharmacist can help determine whether or not there's interactions or double dosing coming about. Acetaminophen is an extremely safe medicine. We use it in the youngest of children. We use it in older adults. If it's used properly, it's very effective for pain relief, for fever reducing. So it's really a matter of education so that we can get consumers to read the label and use the correct dose.
However, measurements and memory may undermine good intentions. If a medication is in liquid form, Altman warns against using a kitchen spoon to administer it because it's not an accurate measurement. She also suggests keeping a log as a reminder of when each dose is taken. With these caveats, Altman says tweens are quite capable of understanding labels on medications, including directions, active ingredients, and warnings. You can find links to both the Know Your Dose website and the Over-the-Counter Literacy Program for Kids by visiting our website at radiohealthjournal.net. Our writer-producer this week is Polly Hansen. Our production director is Sean Waldron. I'm Nancy Benson.
Medical notes this week. We reported last month about the Zika virus and its effect especially on pregnant women in Central and South America. The virus is also established in Puerto Rico, and a few cases have occurred in the continental U.S. Now, federal health officials have confirmed that the first Phase 1 clinical trials on a Zika virus vaccine will likely begin this fall. And if they're successful, that could open the way for Phase 2 trials early next year. Still, it could take years before a Zika virus vaccine is approved. Here's another example of too much of a good thing. A study in the Canadian Journal of Cardiology finds that exercising too much raises the risk of atrial fibrillation more than 5-fold. AFib, as it's called, can lead to a stroke or heart failure. However, researchers say it takes several hours of exercise almost every day to raise the risk. Not exercising at all is much more dangerous. And finally, lack of sleep has been linked to weight gain, and now scientists are beginning to understand why. It turns out that sleep deprivation literally gives you the munchies, boosting endocannabinoid signals in the brain just like smoking pot does. Research subjects who were sleep deprived for 4 days had higher levels of the chemicals than when they were well rested and simply couldn't resist eating cookies and chips. And that's Medical Notes this week. More in a moment.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.